The most painful medical condition ever recorded. Defining extreme pain. Pain is one of the most fundamental human experiences, yet it is also one of the most difficult to measure objectively. In medicine, pain is typically assessed using subjective scales, where patients rate their discomfort from mild to unbearable. However, there are certain conditions that consistently stand out across cultures, studies, and clinical observations, as producing pain so intense that it is often described as beyond comprehension. Among all known conditions, one repeatedly emerges at the top: trigeminal neuralgia. This condition is not associated with visible injury or external trauma. Instead, it originates from dysfunction within the trigeminal nerve, which is responsible for transmitting sensations from the face to the brain. What makes it unique and terrifying is that it can transform even the lightest touch, such as a breeze or a gentle brush against the skin, into an explosion of pain. Patients often describe the sensation as an electric shock, stabbing or burning feeling that occurs suddenly and without warning. These episodes can last from a few seconds to several minutes, but their intensity is so extreme that even brief attacks can be debilitating. Unlike many other painful conditions, trigeminal neuralgia does not always respond well to standard pain medications. This makes it not only one of the most painful conditions ever recorded, but also one of the most psychologically exhausting. What actually happens in the body? To understand why this condition is so painful, it is important to examine the role of the trigeminal nerve itself. This nerve has three major branches that cover the forehead, cheek, and jaw. It is responsible for detecting touch, temperature, and pain in these regions. In trigeminal neuralgia, the nerve becomes irritated or compressed, often by a nearby blood vessel. This constant pressure damages the protective covering of the nerve, known as the myelin sheath. Once this protective layer is compromised, the nerve begins to misfire. Signals that would normally represent harmless sensations are instead interpreted by the brain as intense pain. This is not ordinary pain. It is neuropathic pain, meaning it originates directly from the nervous system rather than from damaged tissue. As a result, the pain is disproportionate to any external stimulus. A simple action such as speaking, chewing, brushing teeth, or even smiling can trigger an attack. In severe cases, the anticipation of pain becomes so overwhelming that individuals avoid eating, talking, or performing basic daily activities. The unpredictability of these attacks further amplifies the suffering. There is no reliable warning before an episode begins, creating a constant state of anxiety. The experience of the patient. For those living with trigeminal neuralgia, daily life becomes a cycle of fear and endurance. Imagine experiencing sudden, intense electric shocks across your face, so severe that they cause you to freeze instantly. These shocks can occur dozens or even hundreds of times a day. Patients often describe the pain as the worst pain known to medicine. Some have compared it to being struck by lightning repeatedly, or having a knife driven through the face. During an attack, facial muscles may twitch uncontrollably, speech becomes impossible, and concentration is completely disrupted. The individual is forced to stop whatever they are doing and wait for the pain to subside. Over time, the psychological toll becomes significant. Many patients develop anxiety disorders, depression, and social withdrawal. The constant fear of triggering pain leads to isolation. Eating becomes particularly challenging. Since chewing can trigger attacks, some individuals begin to lose weight due to reduced food intake. Even basic hygiene, such as brushing teeth or washing the face, becomes a painful ordeal. This condition does not just cause physical pain, it fundamentally alters how a person lives. Comparison with other extreme pain conditions. While trigeminal neuralgia is often cited as the most painful condition, it exists among a group of disorders known for extreme pain. Conditions such as cluster headaches, severe burns, kidney stones, and complex regional pain syndrome also produce intense suffering. However, what sets trigeminal neuralgia apart is the combination of its intensity, frequency, and trigger sensitivity. Cluster headaches, for example, are extremely painful, but tend to occur in cycles and are localized to the head. Severe burns cause widespread tissue damage and prolonged pain, but are often associated with visible injury and healing processes. Trigeminal neuralgia, on the other hand, involves repeated high-intensity pain episodes triggered by normal daily activities. There is no visible cause, and the attacks can continue for years. This combination of unpredictability, severity, and chronic nature is what places it at the top of many medical pain rankings. Treatment and management. Managing trigeminal neuralgia is complex and often requires a combination of approaches. Medications such as anticonvulsants are commonly used to stabilize nerve activity. These drugs help reduce the frequency and intensity of pain episodes, but they do not cure the condition. In cases where medication is ineffective, surgical options may be considered. One common procedure involves relieving pressure on the nerve by repositioning or removing the blood vessel, causing compression. Other treatments aim to damage the nerve deliberately to block pain signals. While this can provide relief, it may also result in numbness or other sensory changes. Despite these interventions, some patients continue to experience persistent pain. This highlights the challenge of treating neuropathic conditions, where the source of pain lies within the nervous system itself. Ongoing research is focused on developing more effective therapies, including advanced neuromodulation techniques and targeted drug treatments. Don't forget to subscribe to my channel for more content. Make sure you like, comment, and share these videos to your friends and family. Trigeminal neuralgia stands as one of the most painful medical conditions ever recorded, not because it causes visible damage, but because it disrupts the very system responsible for interpreting sensation. It transforms ordinary experiences into sources of extreme suffering, making even the simplest actions unbearable. The pain is sudden, severe, and often unpredictable, creating both physical and psychological challenges. While other conditions may produce intense pain, few match the unique combination of characteristics seen in trigeminal neuralgia. Its impact extends beyond the body, affecting every aspect of a person's life. This condition serves as a powerful reminder of how critical the nervous system is in shaping human experience. Pain is not just a symptom, it is a complex interaction between the body and the brain. Understanding conditions like trigeminal neuralgia not only advances medical knowledge, but also deepens awareness of the realities faced by those living with chronic pain.